Okay, now we are going to discuss about corrective exercise for the pathological gait. So first we are going to discuss about the circumdictory gait and its corrective exercises. So here usually what we physiotherapists do, right? Once the patient gets stable, we will start making him to walk, okay? We will support on his affected side and we will make him to walk. At that time what the patient will do, he will lean, he will put all weight over the therapist and he won't use his muscle for the walking and he will adapt that wrong posture and continue to walk even if he gets stable. So it is the wrong method of training the gait. Now we are going to see the corrective methods. So here we have 3 levels of gait training. Okay, so level 1 is preambulatory gait training. So we'll see the demonstration. So during walking it is more important that the patient should have control over his knee. Okay, so to bring back that control, to bring back this balance and stability, we are going to train this method. Here consider he has left side hemiplegic. Okay, so first while training the lower limb, simultaneously we have to train upper limb also. So upper limb will go for the flexor synergy. Here we are going to perform level 1 gait training. In this gait training, both the foot should be in contact with the ground. So we called it as closed kinematic exercises. Okay, so here we should ask the patient to bend his knee and straighten it. So this will be useful for the patient while walking. While walking, the bending and straightening action of the knee plays a major role. So bring back the stability and balance of the patient. This exercise is performed. This exercise will improve the stability and balance of the patient. So this is more important because while walking the knee flexion and extensions plays a major role. Okay, so here this phase is called as preambulatory phase because your patient will not perform any walking but he can gain the confidence that he can able to walk without support. Once the patient able to do this activity, then we can progress it to single leg bending. Okay, usually patient feel difficult to perform this exercise, but it also will be more useful if we try this exercise. It will be more useful for the patient to gain stability and balance while walking. Okay. Now we are going to see about level 2 gait training. Here the patient will learn how to bear the weight on the affected side. So the concept will remain the same. The upper limb will be fixed to the support so that to prevent the flexor synergy of the upper limb. So now what we have to do, like we should place some stable surface on the ground and ask the patient to place the non-affected leg on that surface. Here we can use mat or paper to provide a frictionless movement. Okay, then the non-affected limb should be moving on the ground and the affected limb should be in contact with the ground. So what it happens here, the patient will bear the weight on the affected side. Okay, so here we can drop some water and ask the patient to wipe it off, and we can also add some form of functional activities too. In level 2 training, we can split into 2A and 2B. 2A, we should use the stable surface. Once the patient can able to do level 2A exercise, then progress into level 2B. Here the unaffected leg should be supported in the unstable surface like foam roller, ball, etc. So the paralytic limb should be in contact with the ground and bearing the weight of the body, whereas the unaffected limb will be moving on the air. So here the patient may bear more weight on the affected side limb, and along with that you can add some sort of functional exercises like brushing, combing hairs, etc. Once the patient can able to perform both level 1 and level 2 easily, then you can progress into level 3. Here ask the patient to do heel toe movements. The patient feel difficulty in holding the rails using the affected limb, then the therapist can support him. If not, the patient can hold both the limbs over the rails and he can move up and down. The affected limb should come up first and followed by the non-affected limb. Once the patient can able to perform this, then slowly progress into second step. Okay. Next step. Go up. Down. So this is all about level 3 gait training. Now we are going to see about the corrective exercise for Trenebre gait. So Trenebre gait is usually caused by the weakness of the hip abductor muscles, that is gluteus medius. So we'll see how to strengthen the gluteus medius muscle. The loop band should be worn around the knees. Okay, so once the muscle gets strengthened, then we can progress it around the ankle, because if we wear it on the ankle, we will perform it in the long lever. The patient may feel difficulty. So initially we should place the loop band around the knee joint. Okay, now ask the patient to support over the wall. Here his left limb is affected, and ask the patient to do the hip abduction. Okay, hip abduction. So this exercise is the open chain exercise, as the foot is not in contact with the ground. This resistance band helps to strengthen the gluteus medius muscle. So next we are going to see another form of exercise. Ask the patient to go in side plank position. Okay. Then ask him to perform the hip abduction. Here the lower limb should be pressing over the couch. Okay. Here his core muscles and abductor is working together. Here he should not lift his pelvis. With the help of the lower leg, he should move the upper leg. Here the patient feels difficulty in performing this exercise. So repetitions can be reduced. 3 sets and 5 to 6 repetitions can be followed. So now we are going to see a corrective exercise for hand to knee gait, that is quadriceps avoidance gait. Due to weakness of the quadriceps muscle, the patient uses hand to extend the knee. So we'll see the corrective exercise. The position of the patient should be in the prone lying. So ask the patient to lift the leg up to 6 inches up, sideways, back and down. So ask the person to repeat this for 10 to 5 repetitions and 3 sets. So it will help to strengthen the quadriceps muscle. Now we are going to see about the foot drop gait. Here in foot drop gait, it is due to paralysis of the dorsiflexus, that is your tibialis anterior muscle. So initially we have to give the electrical stimulation to stimulate the nerve and to strengthen the muscles. Once the muscle has get strengthened, then we should progress with the exercises. So concentric, isometric and eccentric. So we'll see the demonstration. So with the help of the TheraBand, ask the patient to perform the dorsiflexion. It should be repeated for 10 to 15 times. So followed by isometric contraction of the dorsiflexus and the eccentric contraction. So now we are going to see about the Wadling Gate. So Wadling Gate is caused by the bilateral weakness of the gluteus medius muscle. So we'll see the demonstration. Here the patient should be in side lying position and the loop band is wrapped around the knees, and ask the person to perform the hip abduction. It should be performed bilaterally. Once the patient can able to do this movement, then we can slowly progress into single leg abduction. Okay, here the upper leg should be straightened, whereas the lower leg should be in bent position. So it should be repeated for 10 to 15 reps with 3 sets. So we can add the pelvic bridging also. It will also help to strengthen the gluteus medius muscle. So ask to repeat it for 10 to 15 reps and for the 3 sets. So now we are going to see about gluteus maximus gait. Here, to strengthen the gluteus maximus muscle, place the patient in prone lying. Ask the patient to lift the leg up to 6 inches and move the leg away 4 to 6 inches, again back to its position and down. So ask him to perform this exercise for 10 to 15 repetitions, 3 sets. This will help to strengthen the gluteus maximus muscle. Once the patient can able to perform this exercise and he has gained the strength the muscle strength, then we can progress to resistance exercise. So the patient should be in quadruped position. So we all know that action of gluteus maximus is extension of the hip joint, abduction and the external rotation. So along with that movement, so use the loop band, perform this movement. Okay, extension of the hip joint, abduction and external rotation. Okay, so ask him Ask the patient to perform it for 10 to 15 reps and 3 sets. So now we are going to see about the ataxic gait training. Okay, so usually ataxia is caused by lesion in the cerebellum. The patient feels difficulty in maintaining its balance, postural stability. So we'll see the 3 coordination exercises here. First, ask the patient to perform the tandem walking. It helps to improve the coordination and balance. So now we are going to see about the scissoring gait. So we all know scissoring gait is most commonly seen in the spastic CP, okay, due to the spasticity of the erector group of muscle. So whenever you start training the exercise, usually go with the passive movement followed by stretch and followed by the exercise. Okay. So next you have to stabilize the lower limb and ask the person to do the pelvic bridging. Down, up, down. So finally, to add up the resistance, use the loop band and ask the patient to perform the hip abduction both in supine and the side lying. Okay, perform. Should be repeated for 10 to 15 reps and 3 sets. Okay, side lying. And it should be done bilaterally. On the side பண்ணிரலாம். Yes. Usually in scissoring gait, there is severe spasticity is seen. So the spasticity management should followed by the stretching, weight bearing, followed by the strengthening exercise. So initially make the baby or kid to sit on the bolster and hold the position for 5 to 10 minutes, followed by weight bearing exercise and progresses to resistance training. So it will give good result. So here finally we have came to the conclusion that from both part 1 and part 2 videos we have discussed about the gaits, gait cycle, phases of gait cycles and pathological gaits and the corrective exercise for the pathological gaits. Thank you.